I am Verna Smith, and welcome to this edition of Issues in Focus. It is a Friday not after the storm because the snowstorm continues in most states in the Union. It's the Friday after the summit, the joint summit in Washington, where President Obama brought together 22 members of Congress to talk health care reform. I must say, pushed by the elections in Massachusetts and understanding that its base is becoming absolutely edgy on what to expect. The president has taken the leadership in saying this time I'm calling the shots, and he brought together, as I said, 22 members of Congress to talk healthcare reform. The issues were cost controls, deficit reduction, expanding coverage, and of course, insurance reform. We watched, I hope you watched, and of course, I was very encouraged by what I saw. Of course, I was disappointed because the president said he had brought the group together, both the GOP and the Democrats, so that they could find out on what they agreed and to see where they could bridge the gap on the things on which they had no agreements. But that did not happen. Early in the game, Senator Lamar Alexander, who first spoke on behalf of the GOP, questioned the process. He actually asked for a promise that the president, at the end of all this, would promise not to use reconciliation, which is about using 51 votes, now that the Democrats have lost their super edge of 60 votes in the Senate, to bring about this legislation. The president reminded him in a short way that this was not about the process, but about doing something, as in giving us some results, giving to us what he, Lamar Alexander, has, and all of the members of Congress in terms of healthcare coverage. So again, yesterday was a summit day. The president was stellar in his performance, and so was all the group. But what was most disappointing was that the GOP continued to say, no, 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 we must start over. And the Democrats are saying, a bill has already gone through the Senate. There's a bill from the House. It needs to be brought into one in conference. And sorry, this is too late, too long into the game to start over again. There are more than 27 million Americans out and without health care insurance. Their condition, their concerns in their family cannot wait. So at this stage, as I said, I was glad to see the president showing that he has a command of what is important at this stage. He did not need a teleprompter. He did absolutely well without it. And the message, I think, was passed on to us that at least this time around, he intends to draw a line in the sand to say, yes, we are concerned about jobs, but healthcare reform is about jobs. Healthcare reform is about putting Americans back to work, and healthcare reform is about saving money in a system that really is absolutely broken, and as I will repeat, absolutely unsustainable should it continue as it is right now. So yesterday, we talked healthcare reform. The GOP had another chance to show us that they were concerned about average Americans, middle-class Americans. I didn't get a sense that they got the message. I could be wrong. What did you think? The president outlined what he thought was important when he gave the case studies on, persons out there who had diabetes. Ara Reid spoke about a man in Nevada whose daughter who had a cleft palate and has been paying $90,000 out of his pocket. We talk about the perils for the small business person in terms of their ability to provide healthcare reform for their workers and what that will mean for the nation at large. So again, we're talking healthcare reform. We're talking the summit at Blair House yesterday. What are your thoughts? I thought, again, as I said, the president made a great move. I'm glad that we had a level of transparency. I was able to see a part of it on television. I was able to hear some of the analysis, and I do agree. Now that all of that has been said and done, it's time for results. I don't care what the president does, if he plans to ram it down the throat. All I'm looking for is results, either in the name of reconciliation. I don't care what it is called. We want a bill. I don't think we'll get a public option, but I hope that something will come out that's not watered down and is not in the end meaningless for average Americans. So again, the issues this week: dominant, healthcare reform. What are your thoughts? Did you see the summit? Did you think President Obama handled himself well? Were you disappointed by the GOP, or you agree with them that we should start over again? Do you think their talking points on step by step from some word science that said these are the words you should use worked, or did it backfire? Again, this is Issues in Focus. Join the conversation. Leave a message, a comment on this video, or leave a comment on my blog, zipinpolitics.com, www.zipinpolitics.com. Would love to hear your points of view. Join the conversation. I am Verna Smith, and this has been Issues in Focus. Talk to you next week.